Can your upper cervical joints get stuck? What would that mean? And more importantly, what would you do to fix it? The first thing to understand is what we're talking about and agree on the definition of what stuck really means. So we'll use the example of your upper cervical area and bring in some examples of other joints that are very similar and function the same way. Really, the first part comes down to, is your joint subluxed and stuck in one position? What is that? What does that really mean? How do chiropractors tend to use that? How do medical professions tend to use that? And then what is physiologic motion? How could a joint be stuck or stiff into a range in a more normal and maybe possibly realistic way? The reason I say subluxation may not be realistic, especially the way we use it in medicine, is that it refers to a joint being partially dislocated, meaning that it's moved to the end of its range and then skipped a little further, disrupting ligaments, creating injuries, and it's a pretty substantial problem, especially if it was in your upper cervical area. Something like that would be exceptionally rare, and you would also see it reliably on x-ray according to the World Health Organization. This would include all x-rays read by radiologists and medical doctors alike, not only the one that you got at a chiropractic office. There has been acknowledgement in the chiropractic community that the term subluxation that they're using is meaning something different from how it was used originally. A lot of schools, as you see here, don't even teach it. A lot of organizations are trying to get away from this model and coming more towards the physiologic motion model that we're going to talk about next. The reality is, if you go in and you took an x-ray and somebody tells you your C1 is pointing 6 degrees to the left, the chances that it's actually subluxed, dislocated, and everything else is neutral relative to that, and it's dislocated 6 degrees to the left, that is just not very plausible and has never been backed up in the scientific literature, and quite opposite, that has been disproven in the scientific literature. So I would say that's very safe to get away from that model of thinking about that you're going in and you're having something that's partially dislocated. It's out of alignment compared to the rest of your spine. That being said, you can for sure see somebody's C1 off axis pointing to the left if you take an x-ray. You can see their neck have a loss of their lordosis or their cervical curve on an x-ray. So you can see movement of the vertebra on an x-ray. So what gives? How is that happening? Really, that's where the physiologic motion comes in, and it'll really clarify and help you understand what's happening to yourself and on x-rays when you can understand this concept. So anytime a joint surface moves, let's say your neck, as you turn your neck to the right, all the joint surfaces in your neck are sliding on each other, moving or rotating around, as in the case of your upper cervical area. That's what allows the motion to happen. This range of motion, the maximum they could slide this way and the maximum they could slide that way, is called their physiological range. Basically, that just means what were they designed to do movement-wise? What is intended? What are the muscles, ligaments, joints, nervous system designed to create and handle? So let's use a simple example before we go back to our kind of C1 being rotated 6 degrees to the left example. Let's talk about how you can see a Dowinger's hump or a thoracic kyphosis on an x-ray, and that'll help us understand how the physiologic motion can cause abnormalities on x-ray, how that could mean they are actually stuck, or it could mean it's a more temporary issue. Thoracic kyphosis refers to an excessive amount of flexion in the already typically normally flexed or bent portion of your upper thoracic spine. On an x-ray, as you can see here, a thoracic kyphosis will look excessively forward bent in that area. Keep in mind, you could find that position naturally right now. You can actively get into that position, but you can also actively get out of that position. What it would mean to be stuck in that position is what you can see in older folks sometimes, is which over time they spent too much length of time in that end range of their physiologic motion into that flexed position. Basically, they held their joint like this, their elbow like this for too long, and then it got really stiff and became too hard to extend. That's a very observable phenomenon. We can all agree that someone can move through their physiologic range and spend too much time there and have adaptations in the tissues that make it harder to leave that position. Our example of seeing your C1's rotated 6 degrees to the left, what does that mean? Your C1 moves around the dens of your C2 to create rotation in your head. Basically, that's a very normal motion for it to do. It's extremely important for human evolution. It allows us to detect predators, hear things. We've been doing it for 100,000 years, rotating our head side to side. A lot of that happens, as you can see at that C1 arch moving around the dens of the C2. So for the example of your C1 being rotated 6 degrees to the left, it could literally be as simple as you had your head almost imperceptibly turned to the left when the x-ray was clicked. And if you saw that and readjusted and tried to align your head straighter, you could click the x-ray again and it would look normal. That being said, if you spend a ton of time in these adaptive postures, similar to this excessive thoracic flexion causing a fixed kyphosis, if you spend a ton of time doing this because you're using your mouse hand, we don't live in a symmetrical world, it's not uncommon to see these things on x-ray. If you spend that much time in that position, it will be hard to get out of that range. If you do this for a long time, it's gonna be harder to do this, especially if you hold that for years, decades plus. So in summary, a joint can get stuck or used to being in one place in its physiologic range. If you always look to the left for your entire life, the tissues would adapt and it would become harder to look to the right. It doesn't mean that it's always stuck. A lot of times, on x-ray, if you're doing this and you're young, healthy-ish, right? You could correct, stand up, do some things, retake the x-ray, and it would look normal. That's why personally, and I think the literature vets this out, it's not fair to say something's subluxed or stuck in one position or the other. It's more helpful to think about it as what motions are restricted, what movement patterns have they had and adapted that have been maladaptive, and how could you fix that? So what does all that mean and how would you fix it? We've agreed that we can hold our body in ways in which it would get stiff over time, restrict motion and restrict function and be altogether not great. That's an easy thing to agree on. It's as simple as saying if you braced yourself like this for a long period of time, it would be hard to straighten your elbow and it would mess with your function. The same thing is true for your neck. Let's go into the anatomy of what could happen with some of the common cervical issues and how that could lead to neck pain, dizziness, headaches, and all the things that we want to fix. So let's use a basic example that there's a lot of good graphics and literature on to describe one common issue with your neck and our forward head posture. Like I mentioned, one feature of that would be that excessive thoracic flexion or like hyperkyphotic upper thoracic spine. When you're in this position, there's a couple things that are happening. One, you're getting stiff here. Your upper back isn't used to extending. You're getting tight in your chest. You're getting stiff in your suboccipital area. You're underactive and getting weak in your deep neck flexors. Obviously, spending 1 minute in that position isn't a big deal. It really becomes problematic when you spend long periods of time in that position. Similar to if you kind of had a weird compensatory side bend of your neck and you only did it for a day, no big deal. If you start to do this for whatever reason for months or years or when every day you're at work, that can become a really big issue because tissues are adapting, making it hard to access your whole physiologic range, and you're relatively stuck in that position. Disruption of that normal function of your neck can cause tons of issues. It can cause excessive pressure on joints. It can cause irritation of nerve roots. It can cause a disruption in the normal proprioceptive function of your neck. This kind of issue, this disruption and length tension relationship from moving poorly and holding your body poorly over time is the basics of what we do in orthopedic evaluation and treatment. All interventions, whether it be adjustments done by chiropractors, whether it's manual therapy done by PTs, whether it's acupuncture, whether it's typical stretching exercise, physical therapy, all of this revolves around trying to restore the normal mechanics and dynamics of your tissues. So for example, if you have this leftward rotation of your C1 that has become habitual for you, you're gonna get different changes on the left side, the right side of certain structures. Something's gonna get too tight, something's gonna get underactive and weak. Chiropractic adjustment or physical therapy, grade 5 adjustment is attempting to influence that length tension, meaning the tightness, the weakness, by neurologic drive of adjusting that area. Manual therapy and cavitations have been shown to create short-term adjustments in the neural drive to an area, which can change the amount that the muscles are contracted in certain areas. The goal is the same. You're trying to make it over time less tight on the tight side and more active on the underactive side. That would be similar to, in this example, trying to stretch out your chest and strengthen the muscles that pull your shoulder blades together to make it easier to avoid this slumping position. Even something like dry needling, for example, is trying to affect the tension and the muscles so that the whole system can work more normally. My belief is that you should identify what the root cause of this kind of chronic length tension imbalance is and work to address that, not only focusing on the short-term solution. So all good practitioners are really treating the same way. You take respect to what you can do short-term to make some temporary changes while working to correct the long-term issues that are causing this issue to be chronic or long-term. Unless you can do something to permanently correct the length-tension relationship, you're never going to truly change the dynamics and function of that person's joint. That's really simple and straightforward, just like saying you can do whatever you want, massage, try to adjust, do everything. If you don't fix the strength and length on both sides of the joint, and you can influence that by those therapies, if you don't do that long enough or fix that joint is never going to function normally again. That's a lot, but I wanted to give you a clear idea of what's going on when you're hearing those things, what you could do to fix it, and really what the goal of all therapies are. So in summary, if your joint is stuck in a position or stiff and won't go the other way, it's likely because there's been an acute injury that has changed the length tension dynamics, or you've spent enough time there where certain things have got stiff, certain things have got weak, and it makes it harder for you to find back to that anatomic neutral. All therapies in some way are addressed at changing that, either through affecting the neural drive to certain areas or over time strengthening, stretching, and mobilizing things to make it easier to get back to that neutral. Really, what you want is you want to be able to find your natural anatomic posture, move, and do everything as you were designed. That allows your body to best accept forces, loads, and handle stress. I think most clinicians would have no problem accepting that as the basis of all orthopedic treatment, and that's a general model I think we could all agree on. What does the evidence say about what is the most effective treatment? Because if I said, hey, there's a lot of ways to do the same thing, what would be the most effective? It really comes down to the individual person and using your best clinical judgment while following the relevant literature. To give you a quick summary of what the literature would say about someone who has neck pain and control issues of where their head is in space, which is most of the people I work with, we'll look at the Journal of Orthopedic Sports Physical Therapy's recommendation for cervical movement impairments. They recommend, and I quote, "A multimodal approach is favored, including manual mobilization techniques alongside exercise, strengthening endurance, flexibility, postural, coordination, aerobic, and functional exercises. It has been found that an effective home exercise program has strong correlation with reduced pain, increased function, decreased disability, and improved neck pain scores. Specifically, home exercise programs were more effective when they utilized self-mobilization techniques, strengthening exercises, endurance exercises, and when they were designed to address a specific spinal level." That's a mouthful. Why did I read that to you? I want to show you that everything is on the table. The research shows that this can work, this can work, this can work, this can work. There's a lot of things that can work. Really what you want is you want somebody who has a clear understanding of what the issue is, a good grasp on the literature, and is willing to work with you to do something that you feel the best about and is the best for the long-term resolution of fixing the root cause of the issue. All right, just tell me if it can get stuck or not. So I think at this time, after spending a lot of my week looking at all the literature, it's very safe to say that your C1 and the normal population going to physical therapy, chiropractic, it is not dislocated, it's not subluxed, it's not shifted within the rest of your spinal column, like independent of everything else. So everything else is neutral and your one vertebra is just shifted. That is just not accurate. It's just not ever been vetted in research, and it would be visible on X-ray, and it would be a medical concern every time. That being said, any joint can get stuck within a physiologic range if it spends a lot of time there, or acutely if you have, muscle guarding, you sleep funky, you wake up, you can't turn your head that way. That's your body's protective response. Over time, if you always held this position, you would start to permanently tighten, weaken in certain areas that made your neck functionally stuck there and harder to find that position. I really enjoyed putting this together. I've spent a lot of time. I know I'm nerding out on this. I hope that was helpful. And I would love if you have questions or if you disagree, please let me know. This is my best summary of current literature and also scientific rationale that has been vetted out. So I would love to hear your opinion and talk to you about what's going on if you're a provider or patient. And I hope you enjoyed this. Thanks for coming to my informal TED Talk.